Clinical implications of laboratory testing. Why specificity matters.
To understand the role of laboratory testing, it is first important to address common concerns many of us have around testing. This includes the increased cost of laboratory testing, especially with the use of newer genetic tests or the possibility of over-testing and inappropriate testing. Finally, what are the clinical implications of laboratory parameters that are poorly understood, such as sensitivity, specificity, negative predictive value, and positive predictive value? Most of us have certainly heard of these terms numerous times. Some of us might have even calculated them. But do we always understand their clinical implications? Especially when there are seemingly trivial differences between different laboratory tests. Let's look at this in more detail.
Are we over-testing?
It is often stated that we are ordering too many tests. However, based on a recent meta-analysis from Harvard spanning 15 years, we are not ordering enough of the correct tests, nearly half of the time. This issue is not isolated to the US, but a trend that affects physicians worldwide.
What about additional costs?
We are constantly reminded about the appropriate utilization of resources, especially in avoiding unnecessary testing. In reality, lab testing, including genetic testing, represents a very small percentage of the total healthcare expenses. Laboratory testing represents around 2% of total healthcare costs, yet contributes to 70% of the medical decision process. Consequently, ordering the appropriate laboratory tests are not only cost-effective, but provide better care for our patients. As the ordering physician, we are ultimately responsible for understanding the appropriateness and limitations of the tests we choose, not only around the possibility of false positives and negatives, but the resulting clinical consequences to our patient from our choices.
For more information or to watch additional videos, please visit our website at thermofisherinstitute.com.